Get ready for a fascinating journey through the darkest chapters of human history. In this video, we will explore the worst epidemics that have ever plagued humanity, from the devastating Black Death to the recent COVID-19 pandemic. Every minute, we will reveal how these events shaped societies, altered historical courses, and influenced the lives of millions of people around the world. Stay with us as we dive into the details of these tragedies, uncovering not just the numbers and facts, but also the human stories behind them. Understand how resilience and science faced unimaginable challenges and how these lessons continue to guide us today. Don't miss this opportunity to learn and reflect on the invisible forces that shaped our present and continue to influence our future. Let's start with one of the most devastating epidemics in history, the Black Death. Between 1347 and 1351, this plague killed about 75 to 200 million people in Europe and Asia. Caused by the bacterium Yersinia pestis, transmitted by rat fleas, the Black Death decimated up to 60% of the European population. Imagine living in a time where death was present on every corner. Entire cities were decimated, and panic spread rapidly. The lack of medical knowledge and hygiene contributed to the rapid spread of the disease. People resorted to desperate measures, such as fleeing cities and avoiding any human contact. Besides the demographic impact, the Black Death had profound economic and social consequences. With the drastic reduction in the workforce, the medieval economy collapsed, leading to a social restructuring that contributed to the end of feudalism and the beginning of the Renaissance. This epidemic forever changed the demographics, economy, and even culture of Europe. Moving forward to the 20th century, we find the Spanish flu, a pandemic that infected about 1/3 of the world's population. It is estimated that between 50 and 100 million people died due to this flu, which emerged during the final stages of World War I. The Spanish flu spread rapidly due to the unsanitary conditions of the trenches and the constant movement of troops. This pandemic was unique in that it severely affected healthy young adults, unlike other flu outbreaks that generally impact the very young and the elderly. Overcrowded hospitals and lack of medical resources were common scenes worldwide. Governments implemented quarantine measures, but the lack of effective communication and initial denial of the severity of the situation allowed the virus to spread quickly. This pandemic highlighted the need for global public health surveillance and better preparation for future pandemics. The next epidemic that deserves mention is HIV/AIDS, which began in the 1980s and continues to this day. This disease has caused the death of over 36 million people worldwide. HIV attacks the immune system, leaving those infected vulnerable to a range of other diseases. In the beginning, AIDS was a medical mystery and a social stigma. Awareness and education campaigns helped reduce fear and misinformation, while medical advances allowed for the development of effective treatments, such as antiretrovirals. However, HIV/AIDS still poses a significant challenge, especially in regions like sub-Saharan Africa, where access to treatment is limited. The impact of HIV/AIDS goes beyond physical health. This epidemic has profoundly affected the family and economic structure of many communities. Organizations around the world work tirelessly to provide care, support, and education to prevent new infections and support those living with the disease. The fight against HIV/AIDS is a continuous reminder of the importance of medical research and combating social stigma. Finally, we come to the pandemic we have all recently experienced, COVID-19. Since its emergence in 2019, the novel coronavirus has caused millions of deaths and drastically changed the way we live. The economic, social, and psychological impact of COVID-19 is immense, and we are still dealing with its consequences. The rapid spread of COVID-19 led to a global race to develop vaccines, resulting in an unprecedented scientific effort. We witnessed an extraordinary example of international collaboration, with scientists and governments working together to combat the crisis. The implementation of lockdowns, mask mandates, and vaccination campaigns were some of the measures taken to control the virus's spread. Beyond human losses, the pandemic has had a profound impact on people's mental health. Social isolation, economic uncertainty, and grief have affected billions of people worldwide. COVID-19 highlighted the importance of readiness to face future health crises and the need for robust and resilient healthcare systems. These epidemics show us that, despite scientific and medical advances, humanity is still vulnerable to infectious diseases. The history of pandemics is a story of resilience, adaptation, and continuous learning. Each of these tragedies has taught us valuable lessons about the importance of science, solidarity, and preparedness. If you enjoyed this video and want to learn more about the history of epidemics and other fascinating topics, subscribe to our channel. Turn on notifications so you don't miss any new content. Leave a like and share this video with your friends so that more people can learn about these important lessons from history. See you next time.